All right, let's talk about something that a lot of guys deal with as they get older. Those frustrating, sometimes life-disrupting symptoms of an enlarged prostate, or BPH. But what if there was a modern, minimally invasive way to handle it? Well, today we're diving into exactly that. It's called prostate artery embolization, or PAE. So, I have to ask, does this feel a little too familiar? You know, that constant low-level anxiety, always knowing where the nearest bathroom is? Or maybe it's waking up what feels like a dozen times a night. Yeah, if you're nodding your head right now, you get it. You know exactly how much this can completely take over your life. So, let's get into the nitty-gritty. It usually starts small, right? Just one extra trip to the bathroom at night. But pretty soon, that one trip turns into two or three. And suddenly, it's not just a minor annoyance anymore. It's messing with your sleep, draining your energy, and just, well, it's impacting your whole day. So let's talk about what those symptoms really look like. And here they are, the usual suspects. That constant need to go, especially in the middle of the night. It's the one that really gets you, because it just wrecks your sleep and leaves you feeling wiped out all day. Then you've got the other stuff. A weak stream, maybe trouble even getting started, and that really annoying feeling like you just can't quite empty your bladder. Look, if any of this sounds like your daily reality, I want you to know you are definitely not alone. This is the classic playbook for BPH. Okay, so what's actually going on here? First, the good news. BPH, benign prostatic hyperplasia, is not cancer. That's super important to remember. What it is a totally normal part of aging for a lot of men. Your prostate gland just, well, it gets bigger. And as it grows, it starts to squeeze the urethra. The best way to picture it? Imagine someone stepping on a garden hose. That's exactly what's happening. And that squeeze is the culprit behind all those symptoms we just covered. So naturally, the next question is, what can you do about it? For a long, long time, the options have been kind of limited. A lot of guys felt like they were stuck between a rock and a hard place, having to pick from just a couple of not-so-great choices. And this really lays out that dilemma. On one hand, you've got pills. Sure, they can help, but they often come with their own baggage. We're talking dizziness, feeling tired all the time, and for a lot of men, unwanted sexual side effects. Then, on the other hand, you have surgery. It can be very effective, no doubt, but it's a big deal. You're looking at general anesthesia, a hospital stay, and yeah, there's a real risk it could impact your sexual function. You can see why so many men have been looking for, a door number 3. And that's where this story takes a really interesting turn. This is where we introduce that door number 3 I was talking about. It's called PAE, Prostate Artery Embolization, and it's a total game changer because it takes a completely different approach. We're not talking about cutting or removing tissue here. This is something far more elegant. So what is PAE really? Well, here's the core idea, and it's brilliant. Instead of surgery to remove the extra tissue, PAE works to simply shrink it. It's a super precise image-guided procedure where a doctor basically turns down the blood supply to the enlarged parts of the prostate. Think of it like a plant. If you give it less water, it gets smaller. Same idea. By reducing the blood flow, the prostate starts to shrink naturally, all on its own. Okay, so how does it actually work? You'll be surprised how straightforward it is. It starts with a tiny entry point, literally a pinhole, usually in your wrist or at the top of your leg. A very thin, flexible tube, a catheter, is placed there. Step 2, using live x-rays as a sort of GPS, the doctor guides that little catheter right to the arteries that are feeding the prostate. And then here's the key part. Step 3. They release these microscopic beads that block up those specific arteries. It's like gently turning off a very specific tap. And that's it. The catheter is removed, and all you're left with is a tiny bandage. No big incisions, no stitches. Pretty amazing, right? So let's just recap the big wins here, because this is huge. It's minimally invasive. You're not under general anesthesia, just some light sedation to keep you comfortable. It's an outpatient procedure, which means you get to go home the very same day. There's no cutting, no tissue removal, no stitches. And here's the one that's a massive deal for so many guys. It has a very low risk of affecting sexual function. It really is a precise modern solution. All right, so the procedure itself sounds pretty incredible. But now, let's get down to brass tacks. What's life like after? Who's a good candidate for this? And what can you really expect from recovery? So who is this for? Well, have a look and see if any of this sounds like you. It's a fantastic option for guys with those moderate to severe symptoms that are really just getting in the way of life. It's for men who've tried the medications and found they either don't work or the side effects are just too much. And of course, it's a huge one for anyone who really wants to avoid the risks that come with traditional surgery. Oh, and it's also a great choice for men with particularly large prostates, where other options might be less effective. And check out this comparison, because this is where the difference becomes night and day. With surgery, you're often in the hospital for a bit. You might have to deal with a catheter for a while, and the recovery just takes longer. But with PAE, you go home that same day. In most cases, there's no catheter needed, and you're usually back to your normal routine in just 1 to 3 days. The difference in the recovery experience is just massive. Now, one really important thing to keep in mind. Because this whole process works with your body, letting the prostate shrink on its own, the relief isn't like flipping a switch. It's gradual. You'll probably start feeling a difference in a few weeks, and things just keep getting better from there as the prostate continues to shrink over time. So it's a process, but it's a process that's moving you in the right direction. So I'll leave you with this thought. Just imagine it for a second. What would it feel like to sleep through the night again, to go on a road trip without planning every stop around a bathroom, to just not have to think about it anymore? Could a procedure that starts with a tiny pinhole really give you back that kind of daily freedom? For a lot of men, the answer is yes. It's definitely something powerful to think about.